Hi, everyone. My name is Adriana Bolin. I use the pronouns she and her, and I am the Director of Racial Equity, Social Justice, and Community Engagement. And I'm so excited to welcome you to our Black Maternal Health Week podcast episode. We have an awesome team here to talk about Black maternal health, and why we're coming together is Black Maternal Health Week is recognized each year from April 11th to the 17th to bring attention and action in improving Black maternal health everywhere. Everyone plays a role in working to prevent pregnancy-related deaths and improving maternal health outcomes. And I'm excited to either start the conversation with you here, if this is your first introduction to it, or continue it and offer you something that you can carry on to continue these conversations in your communities and in your networks. Without further ado, I'd love to introduce or invite those to introduce themselves who are here with you. And I'll first pass it to Sophia to introduce who you are and the work that you do at Fenway, and others can do the same.
Hi, I'm Sophia. I'm one of the clinical operations manager here at Fenway. I help supervise the medical assistants here and help with the daily operations. I have been here now currently at Fenway for about 8 years.
Thanks, Sophia. Pass it to Nancy.
Hi everyone, I'm Nancy Figueroa. I'm one of the nurses here at Fenway Health. I work with the reproductive health team and slash OBGYN team here. So I've very much involved in this type of work. And I've been at Fenway Health for about 2 years now and going on to 3. So I'm very excited to share some information and knowledge back and forth.
Thank you, Nancy. Maddie.
Hi, I'm Maddie Wise. I'm a nurse practitioner on the OBGYN team. I use she, her pronouns, and I've been at Fenway for 3 years now.
Thank you, Maddie. Jasmine.
Hi, everybody. My name's Jasmine. I'm one of the nurses here at Fenway Health. I've been here for about 7 months, but I have been in like the OB area for about like 6 years now.
Thanks, Jasmine. And Pyle.
Hi, everyone. My name is Pyle Srinivasa. I use she series pronouns. I'm a physician and have been practicing OBGYN for 14 years. I am the Director of Reproductive Health and OBGYN here at Fenway and have been at Fenway for a year. And I'm also a mom.
Thank you, Pyle. Thank you all. I'm glad to be here with you all. I'm glad we're talking about this. It's important. And thank you all for raising the importance of having this dialogue together with our community virtually. And hopefully that continues on our socials as you all see this. I wanted to start off by just inviting whomever would like to offer a reflection on why Black maternal health is important.
I can start
I
if
think I can jump.
oh, you want to go?
Yeah, sorry, Pyle. Thank you though. I just think that well, it's been kind of known now that Black maternal health has been, in a sense, been really hard here in not just Massachusetts, but in the United States. The numbers can kind of show it too. If you look at the CDC's website, they have been trending these numbers for a little while now, since 2018 to 2021, and the numbers have skyrocketed over the years, specifically in the Black community. And so having more of a conversation about why this is going up rather than either being at the same level as their counterparts or also maybe trying to bring it down overall, right? It is a conversation to be had so we can try to address it in whatever ways we can. So having these conversations and making sure that we create those good action plans within our communities is how we start.
Thank you, Nancy. Kyle, would you like to add?
Sure. I mean, 80% of perinatal deaths in this country are considered preventable. And we know that our Black patients are dying at like alarmingly higher rates compared to Caucasian patients. It's like it was anywhere from twice as many to now 3 to 4 times as many. And we know that there are kind of significantly higher rates of complications specific to our Black patients, like there are higher rates of depression and diabetes, preeclampsia, preterm birth. There's like a very long list. And even when you control for socioeconomic factors, that rate is still really high. And so even when you're trying your best at kind of controlling for the care, there's still bias. And so I think that it's really important to have these conversations to address that because it's really kind of like an ongoing educational effort. And then just to kind of, for me personally, having been a patient, having been a provider in a few different settings, it's really kind of apparent that health outcomes are really related to your zip code. And the care delivery also changes depending on where someone is. And it's like incredible, even in states that are even open to having these types of conversations, it still exists. And so I think this is a really long process and it's a slow process, but I'm glad that we're engaging in it because it's the kind of the first steps in making change.
Thank you, Kyle. Something you said struck me, and this aligns with you mentioned, Nancy, as well, in that is so much that we have to do to mitigate the impacts of Black women at being at such a higher risk for pregnancy. And I'm wondering, like, where is this coming from? Kyle, you mentioned even after you used language that's not coming to me now, whether it's like correcting for, or what did you say?
I said
For
like despite for
socioeconomic
educational or
status.
socioeconomic factors, you know, when you compare these patients kind of head to head, that Black patients are still at higher risk for
Yeah, where is that
pregnancy-related
coming
complications.
from?
I mean, I think it's the hard thing to say. It's bias, right? Like people are treated differently. No matter how well we think we are doing at educating ourselves and how unbiased we may think that we are. When I say we, I mean not necessarily this we, I mean like the proverbial like healthcare system we. There's a lot of implicit bias. There's a lot of explicit bias too that patients face, and and then I think that takes just a very long time to mitigate. But part of that is having these conversations. Like sometimes I think about like if I'm in a disagreement with someone in my personal life, like if they apologize, but we don't sit in it a little bit, in terms of the conflict, like it doesn't really get better. Like we can move on, but we don't necessarily like move forward. And I feel like part of what needs to happen to really kind of level the playing field when it comes to outcomes for our Black patients is to sit in it. Like we have to really acknowledge that this exists, and we have to kind of answer some of these kind of tough questions that are challenging. It's like challenging to do that internal reflection and kind of realize, yeah, we potentially do treat people differently.
I'd like to add also to that through the long history of treating minorities and women of color differently, there's now such a strong mistrust in a lot of patients within the medical system that I hear talked about a lot about, just the mistrust of providers. And so I think it's, it ultimately stemmed from the way that they were treated, but it's then kind of, it backfired. Like it's coming from both sides. It leads to them not getting the care they need also because they might not realize they need it or not want to go see a provider that they don't trust.
Maddie and others, do you, like, as providers, do you see those experiences yourself? Like either yourselves doing, like perpetuating the or carrying out those behaviors or others? And what comes up for you, if you don't
I
mind sharing?
I personally have. And one of the reasons why I became a nurse is because I also wanted to be that advocate for our patients and for people like me, people that might be going through what I'm going through. And like I have many experience because I've been a nurse now for about 14 years, many experience that I have advocated for our patients that showed a big impact. I had one patient at one of the providers like, no, I can't see them right now. Um, like it's not that emergency. I was like, no, I believe this is an emergency. I had to talk to another doctor that helped step in for me as I'm advocating for the patient. And sure enough, if the patient didn't go to the ER within that hour, the patient could have died. So it's simple things as that. And personally, what I've gone through when I have my mom as well. And when I have a high risk pregnancy because I have SVT. So as I was searching for who's going to be my OBGYN, I wanted someone that also specializes in cardiology, but also for my own health as a Black woman. So I had found one, I did a lot of research, and I loved the OBGYN that I ended up having. And that makes a big impact because I know they're putting my needs first. And I already one of the things I suffer from is preterm pregnancy, and I have had miscarriages. So having that right provider that understands you and knows you makes a big difference.
Thank you so
Um,
much, Sophia, for sharing your experience with
Yeah.
us.
Pregnancy is a really vulnerable time for people, like there's a lot of uncertainty, there's going to be pain. And I think there's a really great data kind of with pregnancy, but also outside of pregnancy, that kind of racial and ethnic concordance between patients and providers leads to improved outcomes because there's kind of enhanced trust. And so there's a lot of work to be done to kind of help diversify our healthcare workforce, you know. And Jasmine and I used to work together outside of Fenway, and we had several patients who either didn't want to answer demographic data questionnaire because they thought that that information would potentially lead to bias if they answered. And in that community, there weren't a lot of Black healthcare workers. And so in that community, even though I'm not Black, ended up being kind of the closest thing that someone could see, a patient could see that for, as a minority provider. And I think it's just really, I think it's hard on all ends, So I think that there's kind of multiple layers of things that we need to kind of work on. But even like yesterday, I saw a patient who came all the way from Framingham to Boston to get care here because it's hard to find kind of concordant care when it comes to race and ethnicity as you get into communities outside of the Boston area.
There's something you just mentioned, Pyle, about the layers. There's so many layers, and I'm thinking about the layers of racism, inequality, and discrimination. And I wonder how those lead to the disparities that you all see in your work and in the world and among your patients in Black maternal health.
Well, I think like one of the things that Maddie had mentioned, there has been mistreatment of people, right? Like there has been mistreatment of Black people in the healthcare system, and that has led to adverse outcomes. And that mistreatment, I think, can perpetuate mistrust, and that can sometimes lead to delays in like what we see in obstetrics is sometimes delays in early prenatal care or preventative health care, like vaccination rates, or kind of postpartum care. So I think that there are some significant downstream effects. And the other thing I think is just like I had mentioned earlier, like the healthcare workforce, there's a lot of um, kind of bias and discrimination when it comes to kind of education that will lead to amplifying diversity in the workforce. And I think there are some kind of policies in place with the current political administration that are working on, increasing like diversity in the doula space and midwifery care and nursing care. But there has to be like a really multifaceted approach, I think, because it's a multifaceted problem.
I
Thank
find
you,
one
Pi. Oh, go ahead, Sophia.
I find one of the biggest things too is resources. Sometimes the resources is not there as compared to I still see when I gave birth to my child. Yes, they had a lactation nurse there, but I didn't see them come try to help me as much as I've seen them go try to help others that are not of my color. And when it was me, even as a nurse, I still needed a lot. I had a lot to learn about lactation, and I didn't have that resource that I thought I would. And then I also, on myself, didn't advocate for myself, which I should have. But I did a lot of my research after, and then when I came actually back to work, one of my colleagues was like, saw that I knew so much about lactation and how passionate I became about it, and encouraged me to go become a lactation nurse so we can be that resource for our patients as well to give that education.
That's amazing. Advocacy is so important. And I was thinking about how what you just offered, Sophia, is like the other side or the impact, one of the impacts of racism and inequality on the actual individual. Like you were speaking from both a provider and an individual that is feeling that. Jasmine, I saw you unmute and I wondered if there's anything you wanted to offer related to how racism, inequality, or like these levels of oppression might lead to disparities that we see in Black maternal health.
Yeah, I was gonna touch on like a little bit like what Sophia said, like on the nurse's standpoint, because I personally never had kids, but I before I worked at Fenway, I worked at a postpartum unit, and I want to say probably it was only me and two other Black nurses on that unit, and the unit was a pretty big unit. It was like probably like a 50-bed unit, so we had a lot of postpartum patients, and every time I was assigned to a African American or a person of color, they were just so happy because they know that they had a person of color who was going to advocate for them. And I will never forget, there was this patient who was from Brazil who didn't really know English, and a lot of the other nurses were very judgmental towards her because one, she didn't have like the resources again that other patients might have. And she needed like a lot of social work, and a lot of the nurses were judging her on why would she have a kid if she don't have these resources. And it just goes to show that why do we have to be this way? Why can't we just help them? And I just will always remember I just sat in that room with that lady for 2 hours making sure she got every resource she got before she left the hospital. And it's just shows that like racism within the healthcare system still is very prevalent today, and it's something that probably is going to change over time, but then who knows, because it's still people are very much stuck in their ways, which kind of makes it sad, and which kind of makes a lot of people of color not trust the healthcare system. And as I can speak, my sister, she don't trust the healthcare system. She had 3 of her last children at home, and she will never go into a hospital because of the racial differences she faced when she was delivering her first 3 children. So yeah, that's what I wanted to put out there.
Thank you, Jasmine. Hearing you say that has reminded me of moments in my own care. I've never had a child, but just in general, in my own care in different spaces where I've felt so affirmed. And there's like a literal sigh of relief when I see someone that looks like me. I might not know their specific identity. And then like when that person looks out for me, which somehow in healthcare spaces happens like 99% of the time. Other times, like, they're stressed themselves, so that's probably why they can't, like, they're holding a lot of different pieces. But when I receive that support, especially when it seems like it goes beyond what you get normally or what's the normal range, it's so impactful. And I have a follow-up based on that. To be a Black woman, or even to be a person of color, and hold that space in ways that you don't see your colleagues are, who either are also Black or a person of color, but just holding that space as someone who is a person of color or Black, and also like experiencing it yourself. What is it like holding all those experiences, both like perhaps as a patient, as a provider, as a human, seeing all these different levels? If you don't mind sharing, anyone, what is that like for you all?
I think, oh, go, Nancy, why don't you go ahead and then I can share. I saw you unmute briefly, so.
No, it's okay. Thank you. Appreciate it. But I was just thinking about, like, sometimes when you wear different hats, like, it can be a little exhausting, and so stripping them at night can be very helpful, right? So like, I have, like, I'm a woman of color, and so that is like my first layer and my first intersectional identity, right? And then I add in that I am a nurse, but I'm also a doula. So, and also a student going to midwifery school. So when you add in those layers of being all of that, right, and you day to day, along with adding in that when I have a patient that may be a person of color, that I should also bring out not just me as a nurse, but bringing out that I'm also a person of color. It's not only comforting, but to have like that shared experience with our patients, but it can also lead to that burnout sometimes, right? I have to add in sometimes a lot more care for folks in that space, but that's not saying that it's not rewarding. It's just that making sure that we also fill our cups outside of that too, and making sure that we're able to kind of rest and add to, because that's also radical self-care, right? Making sure that we're not only being able to care for our patients in the best way, but doing it for ourselves too, and whatever hat we're wearing, right? So I think it's really important to shed light on that too.
Thank you, Nancy.
I kind of go between, like, I agree with Nancy. I think it's draining, and I waffle between it being draining and invigorating, because then you hear people like I think here at Fenway, people on our team do a really great job of advocating for our patients. And I think that because we are aware of these biases, I think a lot about like equity versus equality. Should we approach things the same way, or do some people need a little bit more? And we know that some people do need a little bit more advocacy to get what they need. And I think that people here are very aware of that and are doing that. And I think that that can be really invigorating too, and inspiring for us to kind of continue to do that. We have to do some extra work for some people, and that's fine. And I think that, like, it's really different when it comes to how we're trained. Like, a lot of times in the healthcare system, the way that you're trained is kind of engulfed in this climate of fairness, like what is fair. And that oftentimes means treating people the same way. But actually, maybe we shouldn't be treating people the same way, because maybe some people have different needs or are being treated differently. And we have to kind of essentially like accommodate for that or compensate for that with advocacy or with listening or with time or resources, you know.
Yeah, thank you for offering that, Pyle. Like, there's no one size fits all. Like, we all need different things. We're different humans. And it would be nice to get to a balance where we're able to give the time and space that we need to patients based on what they need in a very equitable way. Other reactions from folks to this question?
Kind of just want to comment
Yeah.
on what Nancy said, because I think it's so amazing how you're able to kind of approach it with from such like an intersectional way. Like, you're adding all these different layers of who you are and how you can help these people. I think that's amazing. But I mean, like you said, it's also draining. And I can't imagine how much pressure that must also be. Or like Jasmine, when you were helping that that patient when you were on the postpartum floor, like that's wonderful that she felt like she could trust you and you were able to help her. But yeah, but that's also a lot of pressure, I think, to walk on the floor and say, okay, like I have to help all the people of color today. Like that's especially if there's not, if there's only one other nurse of color on, or it's just you on that day, because there's only, even though there's maybe 3 Black nurses on your floor, they're not all on the exact same days. So anyways, I'm just trying to imagine, like, that also must be a lot of pressure.
Thank you, Maddie.
Like, wouldn't it be nice if everyone stepped up, right? Like, instead of like Jasmine's example, like Jasmine going the extra like 25 miles for this patient, like, wouldn't it be nice if everyone else that this patient had come into contact with, and there were probably a lot, had just done a little bit more? You know what I mean? Like, that's, I think, the end goal in my mind, is like, that's where I would like to see us in the healthcare system, where everyone is kind of approaching it in this way.
And is what is getting in the way of that being what we mentioned before, the bias and all those different layers, or is it something else? Like why I was gonna say it's so easy for us and we just acknowledge how hard it is. So it is not so easy, but it is something we prioritize. And you described that you all prioritize that in your work. What gets in the way of that being prioritized more universally in the way that you all prioritize it?
I can say some from like what I see too. COVID has changed healthcare a lot. And since it has changed healthcare a lot, there's a lot of burnout. So that focus that we, as strong as it should be, has deterred a lot from healthcare, I have found, even for my personal health. Um, and I think us working how we're saying here as a team, like, nope, we're not going to let that burnout stop us. Our patients come first, and we're going to strive as hard as we can to continue to make that impact. And I continue to see that here on our team here at Fenway.
So proud of y'all. Just wanted to say that. It feels great that we're having a discussion about a way of practice, a way of engaging with other humans that we actually practice here. So I'm just really grateful for you all, and that you all are those constant advocates for our patients and folks who are thinking about being patients too. Why are you passionate about Black maternal health? That may have been implied from what we've all shared, but I'm just curious, like specifically you all individually, what brought you here to be a part of this conversation? Like yeah, I said all the words. What inspires you to be here and to see Black maternal health as important?
Because I'm important, and so are others.
I think, I grew up not knowing about a lot of these things. Like, I grew up the daughter of like an immigrant family in a very not diverse community, and racial discrimination was not something that was like taught to me as a child, but it's something that like I see around me, and I've seen it in the healthcare system. And just as a minority, I've experienced microaggressions, macroaggressions, and I just I think that like very people don't realize that much of bias is taught. It's so ingrained, but it's taught. Like, people don't come out that way, and I have daughters. Like, I don't want them to have this world when they are in this position to become parents themselves, if that's what they decide to do. Like I want them to be able to not be fearful of coming into a hospital to deliver a baby because they're going to be treated differently. Like that's not how I envision the world for them. And I think it's really important to work towards a space where that's not their experience, like now for our patients, but also, selfishly for my own children.
Thank you, Kyle. Maddie, I see you unmuted, and I see you, Nancy. So we got a queue going.
Yeah, for me, I mean, just from hearing like stories and seeing statistics, like it's just the facts. When I see the rates of maternal mortality and morbidity by race and ethnicity, it just shocks me. And when I hear about like experiences of friends, family, and or my patients and what they've experienced in the healthcare system, it makes me so sad. And it just makes me want to try to understand it and have some kind of impact, even in a small way.
Thank you, Maddie. Passing it to Nancy.
So for me, one, I am a woman of color, and I experience the healthcare system like any other person. But obviously, like we've been talking about, we get hit sometimes with different barriers. And so one, I want to do it for many reasons, for people that look like me, right? And people that may not look exactly like me either, right? That may be falling into whatever category that may be some boxes that we put folks in. But I've been noticing that a lot of my drive for this is because I want to make sure that we bring to the care more love and empathy and more actual like meeting people to where they are. And so I want to be that person that is able to bring that to the table when people are in this vulnerable state of either being cared for as a woman or being cared for their pregnancy and beyond. So that is why I've actually been trying to implement different ways that I can be that representation for people in those spaces. And so that's why I became a nurse, and that's actually also why I became a doula, and that's why I'm moving forward to become a midwife. And so I want to continue to be in different ways and also be in interprofessional work, right? To be also that workspace within the team to be able to advocate and also help the patient to advocate for themselves. And so I think that that's what I've been kind of driving my work and everyday ways. So, yeah.
I love what you just said, Nancy, and what like especially touched me is when you said, what I want to bring to the table is love and empathy. I've been thinking recently about what's really important to me as an individual for whoever is interacting with me, especially in my relationships, like personal, professional, like what are some aspects that are important to me? Empathy is really important to me too. And the same would go for my provider. And so I so appreciated to hear, what you want to bring to the table to your patients is empathy and love. Thank you. Would anyone else like to share I see you, Kyle.
Yeah, I was just thinking a little bit about what Sophia had said about how kind of COVID has changed things. And I do think that like it's a little less personal, right? Like we're all in the same space but in different rooms, you know what I mean? And I think as technology evolves and there's all this push to do like digital health, like medicine still needs to be human, and especially in OB, like we are the warm and fuzzy field, like we bring, I always say, like the warm and fuzzy. And so I think that it is really important to keep the human aspect of medicine, specifically in OB. And I think that's one of our strengths in this field. And so I think kind of centering what we do around that human aspect is really important. And I think everyone here does that without even thinking about that, which is why I like working with these people.
Thank you, Kyle. Jasmine, Sophia, anything you'd like to add around what brings you here? Why is this important? And I want to call out, you all have expressed deeply why this is important to you. Just wanted to give you an opportunity to share if there's anything else you'd like to add.
Yeah, I would like to add that this is important to me because you never know. I might become a mother one day, and I just hope just like diving into this topic, hopefully it will change for the better and like people start bringing more care and empathy, like what Nancy said. And I try to do that for my patients, no matter what color they are, but like treat everybody the same. My dad always used to tell me, treat people the way you want to be treated. And I feel like a lot of people should go by that because you don't know if this person's having a bad day. And just to see that people like me are just like faced with all these difficulties within the healthcare, I just want to make sure I'm always there for them and advocating for them.
Thank you, Jasmine. Sophia.
And I agree with Jasmine fully and everyone else on this team as what they have said. We make a difference. We being like, it's not maternal health, but like my father, he did not have that advocacy sometimes at the hospital. And I saw some of the challenges he experienced as a Black man. And that turned me over as I want to be a nurse and to be there for my patients and continuing to advocate and being that voice, regardless of what we're going through, is just continue pushing along and trying to make sure our patients get the care that they need. Because sometimes it's not by the textbook. A lot of the time, it's not by the textbooks. It could be different things, symptoms that patient has that you're unaware of, and the biggest thing is listening to the patient, and that's what I want to try to continue to do, to listen and hear them, and see what we can do to make that difference.
Thank you, Sophia. Yes. So I want to close us out here. We've talked a lot about different experiences that can happen in the healthcare space and ways that you all mitigate that. And I wonder what might be the role of everyone to reduce Black maternal health from your perspective. What can individuals do, or what can we do collectively to address maternal health that might be outside of what you all discussed doing specifically as providers?
I can say one of the things is cultural competencies, having those trainings for healthcare providers to help educate them on Black health and to increase awareness and changing policies that can be biased to increase that healthcare for the Black culture.
I think speaking up is really important every time you kind of encounter any sort of bias, discrimination, microaggression, macroaggression. I think that, I mean, we all have days where we're not perfect, and I think that that's okay. But I think if we can, and we're human, and I think it's okay to fail, as long as we're learning from those failures. And I think that we really should be speaking up when we see these things, because and then having this culture of humility, like, oh yeah, I am biased myself, or I said something that maybe I shouldn't have, or maybe what I did was biased, and I'm learning from this. And I think kind of having that culture of like, it's acceptable to call people out, or to speak up, and instead of kind of being silent when we are witnessing some of these things. I think that for some of us, that's really hard. Like for me personally, I tend to be a little bit quiet and I like to listen more than I like to speak. And so it's hard for me to speak up sometimes when I notice a bias or a discrimination. But I think that's something that we have to keep doing, to kind of get to the place that we would like to be in.
Thank you, Sophia. Thank you, Pyle. others? Do you agree with what you've heard so far about what everyone can do to reduce the disparities in Black maternal health? There are other things that you all would offer to what we can do?
I think one other thing that people can do is kind of educate themselves, which that's also like a broad statement, but I think, reading articles or talking with people about their experiences, evaluating your own experiences, like really giving a lot of thought um, to Black maternal mortality and morbidity, and just kind of trying to learn a little bit about it. I think even just like as soon as you realize how intense this is, I was just for example, like last night, I wanted to prep a little bit for this. And so I was with my sister and I was like, oh, can you help me? And we were doing a little bit of research beforehand. And my sister, who does not work in healthcare, was like, wait, this is insane. What? Like every new article, every new fact, she was like, wait, are you serious? This can't be real. And I'm like, yes, this is actually a thing. And I think that knowledge is power. And especially for people who don't work in healthcare, like just being aware of this, I think is kind of the first step.
Thank you so much, Maddie. And it's like those moments, what you just shared, like that moment of awareness that you just brought. Also, I love that you were preparing for, not that like nobody was, but just means a lot. Like you on your time after work that you were taking this. So appreciate you. And the moment you shared is so amazing. Like some may see that as a small interaction, but you just opened up someone's awareness. Like now that might invite that person to think of other communities that might experience. So just those moments are so powerful. Yeah, so thank you. Would anyone else like to offer what everyone can do? I'm gonna have one closeout question for you all. All right, I'm gonna go for the closeout question. This has been so lovely. Ooh, I feel warm and fuzzy, which makes sense. The warm and fuzzy field. Just so you know, I'm feeling it. What can you all see yourself doing today? One thing to mitigate or address disparities in Black maternal health? What is one action you see taking place in your work today that you see as a way to address or mitigate disparities that we see in Black maternal health? Whoever wants to start, and then we'll just go around till we've all had an opportunity.
This podcast is one that was shown today. And then just being able just to listen to others and being that voice.
I'll say, sometimes it's just an extra few minutes with your patients, and just kind of really listening to where they're coming from. I think like that's something that you can do pretty much every day, and sometimes those like 2 minutes of listening go a really long way. And yes, it may mean that you're running a little bit late for your next patient, but I think it can be really impactful. Um, I think that we're all here because maternal health is a reflection of society and our society's priorities. And if there are disparities in maternal health, then I think that's a reflection in our society's priorities. And so I think that like there are really tiny things that we can do on a day-to-day basis. And for me personally, I think time is actually really helpful.
I wanted to say that today, as long as I make another person smile, we got the win, right? No, I think that as long as we have a conversation and I'm able to make someone smile, even bring a smile to the table when I first meet them, and make them feel comfortable in this healthcare facility at least once today, that's a small win.
I think just like that aha moment that my sister had with me last night, I want to help create a few more of those. So maybe I'll share this with my friends, talk about it. I think it's a good goal to just try and spread that awareness to more friends and family.
Nancy said what I was gonna say. Just making somebody smile, making somebody's day today. That's my goal. That's my goal every day.
Thank
I
you.
was
Oh,
gonna say you
Kyle,
all made my day.
my day is made too. And I was going to share what Sophia shared, and just the creating this podcast with you all, this episode, is what I'm doing today. And I'm so grateful you all have taken the time to come together to have this conversation. I'm excited for continued dialogues about this. I'm excited to, on and offline, hear about more moments. Like, moments just get me so excited because it's like, it's these seemingly small moments that change cultures and societies. We are the ones. So grateful for y'all joining us. And I invite you all who are viewing this to dialogue with us on what you think, what's coming up for you, and continue to look out for more from our team here and Fenway Health broadly, and excited to continue to engage with you all. Bye.